Hi, I'm Julia, one of the midwives at OHSU, and I'm going to be talking in this video specifically about birthing in the water. In the water immersion video, we talked about not having a lot of robust research around water birth. So the midwives are using both the research that we do have and our experience to make sure that we have a safe environment for both mom and baby during labor and birth. What we do know is that the APGAR scores are similar for babies who are born in the water. There's a similar infection rate compared to babies that are born on land, and there are no additional NICU admissions for babies that are born in the water, as long as we follow the safety parameters that we do here at OHSU. One of the most frequently asked questions about water birth is, why doesn't the baby breathe underwater? So I wanted to take a minute to talk about the physiology of the baby's first breath. In general, the baby inside is inside a watery environment, and although they make some breathing movements, they aren't actually passing air through their lungs until they're born. In the case of a land birth, as soon as the baby's face meets the air, there's a reflex that causes the baby to take that first breath. When a baby is born under the water, the environment is similar to that inside the uterus, and so the diving reflex keeps the baby from taking that first breath until the baby emerges from the water and the air hits the face. For that reason, it's really important that the baby's face stay under the water for the entire birth. It's also how we identify women who may be able to continue laboring in water, but we wouldn't want them to birth in the water. Because the only thing that can interfere with that diving reflex is if the baby has some stresses either before labor or during labor. What happens in that case is that some chemicals can build up in the baby's body that will interfere with that diving reflex, and then there is actually a risk that the baby could take a breath underwater. So back to the birth itself. We will help you with your positioning during your pushing, and at the time of delivery, we're going to bring the baby promptly but carefully up to the surface of the water, and that's when the baby will take that first breath. One of the important things to remember while you're pushing and delivering in the water is that if the baby's head happens to come out of the water prior to the delivery, you'll need to stay out of the water for the remainder of the process. In that case, the diving reflex will have happened, and we don't want the baby's head to go back underneath the water. The baby will then be in your arms. We try to keep the baby's body in the water to keep the baby warm. And whether we deliver the placenta in the water is up to the midwife of the day. Sometimes we'll have you squat and deliver the placenta and you can remain in the tub. Sometimes we'll get you out of the water and onto the bed for the placenta delivery. If we're worried about any extra bleeding, we'll get you to the bed where you can continue bonding with your baby while we deliver the placenta and do any repair that needs to happen. Your waterborne baby may be slightly slower to pink up at the time of delivery than one born on land. Remember, the cord keeps pulsing and providing oxygen to your baby, and the baby will be warm in the water in your arms while we wait for the cord to stop pulsing.
Hi, I'm Olivia, one of the midwives at OHSU. I'd like to talk to you about situations where it may not be safe for you to be in the water at all during your labor process, or where it may be safe to be immersed in the water during labor, but not to ultimately birth underwater. First, I'd like to talk about some situations where it's not safe to be in the water at all during any point in the labor. This list includes preeclampsia, which is having high blood pressure with protein in the urine, an active infection such as genital herpes, or if you're positive for HIV, hepatitis B, or hepatitis C. If we need to monitor your contractions or the baby's heart rate with an internal monitor. If there's any difficulty with monitoring the baby's heart rate with our wireless monitors, or if you have abnormal blood pressure, heart rate, temperature, or any other concerning signs for infection. There's also some specific situations where it's safe to labor in the water, but ultimately not to birth underwater. This list includes if the midwife is concerned that you have a large baby. And ultimately, this will be a decision that's made during the labor process between you and your midwife, depending on how large we think the baby is, how the labor is progressing, and how the baby is descending during the pushing process. If you have gestational diabetes that is not well controlled, or if you're taking medication or insulin to manage your gestational diabetes. If you've had a prior shoulder dystocia, that's where the shoulders had trouble fitting through the pelvis when the baby was born. If you're having more bleeding than normal, If the baby has taken a poop inside, that's called meconium, or if you've had a cesarean birth in the past, or if for any reason we think it would be a challenge for you to get out of the tub quickly. What other risks are there to think about when giving birth under the water? In any birthing process, there's a risk of having a short umbilical cord. As the baby is born underwater, the midwife will be assessing to see if the cord appears short. If the midwife assesses that it seems to be short, we'll ask you to stand up to birth the baby standing. We're trying to avoid putting too much tension on the cord. And remember that once the baby comes above the water, we want the baby to remain above water. This can all happen really fast, but the midwife will be communicating with you about how to do this safely. Finally, there's the potential that being in the birthing tub could cause a short delay in handling an emergency. This is part of why we have our criteria list of who we think is safe to deliver under the water or not. If we do identify there's an emergency, we'll help you get out of the tub as quickly as possible to manage that. Hopefully this video has provided you with new and useful information about having a water birth with us at OHSU. After watching this video, please bring any questions that you have to the next visit with your midwife, and we'll be happy to review them with you. Around 36 weeks of pregnancy, we'll review together the consent for water birth, go over any more questions that you have, and sign it together at that time. A copy of the consent form and other resources that you might find helpful are located in our resource tabs. Remember, you can come back anytime to look at that or this video if you have other questions. Thank you from all the midwives at OHSU. We look forward to working with you.